Good afternoon and welcome back to the Disaster Podcast. We're here in beautiful Atlanta, Georgia at the Disaster Preparedness Conference, and we want to thank NACCHO for having us here. I'm certainly learning a lot about things I don't know. And my guests here today, we're going to talk a little bit about radiation community reception centers, which I have to admit I don't know much about. As a paramedic, I know that radiation is something you can't see it, hear it, feel it, or smell it. And I know a little bit about IEDs and dirty bombs and that kind of things, and you guys will have to enlighten me. So on my left here, I have Sherwin Levinson. You want to tell us a little bit about yourself and what you do,
Hi.
Sherwin?
I head the Medical Reserve Corps serving Georgia's Gwinnett, Newton, and Rockdale counties, and that is an all-volunteer nonprofit organization that helps emergency management and public health when their resources are exceeded. So our people train. Typically, we have training sessions once a month, and because of Armin here, we have become experts in what volunteers would do in response to a radiation disaster.
And being a member of some volunteer organizations, including an MRC, I can appreciate that. Armin Ansari, you work for CDC, correct? What do you do there?
I'm a health physicist, and for those who may not know, health physicist is a radiation safety professional in the radiation studies branch at CDC here in Atlanta. And our job basically is to provide the resources and tools and materials and guidance for responding to radiation emergencies and working with our partners at local and state level.
I don't believe I've ever met a physicist, so I feel honored. You have to be a very smart guy. Kevin, you're O-R-A-U. You want to explain to us what that is and where do you work?
I'm a health education specialist with Oak Ridge Associated Universities. And in my current role, I'm supporting CDC Radiation Studies branch in developing training and planning guidance for state and local public health on radiation preparedness topics.
Wow, that is a big topic, and what we're specifically talking about is radiation community reception centers, and I will throw that out to you fellows because I don't have the first clue on what that is. How in an emergency would the public know about that, and how does information get out of them? So that's out to them in terms of where they would go in a radiation emergency. So Sherwin, why don't we start with you?
Okay, well, let's start with why would we even worry about it?
Good point.
I heard a great quote about this just last week on a program about disasters, and the guy said, well, you know, even if there's only a 1 in a million chance of it happening, that means it's happening to 300 people in this country right now. Wow. And while that's not statistically correct exactly, it gives you a good perspective on it because you think that something isn't very likely, but it's going to happen somewhere. The question is, where is it going to happen? Atlanta's a transportation hub, and there are all kinds of radioactive materials passing through Atlanta all the time for medical purposes and so on, also industrial purposes. While there are huge precautions taken, an accident could happen. And that's totally, discounting the possibility of a deliberate act like a terrorist attack. So that's why we would need to be concerned about it. If there were a concern, if something happened, you can imagine that hundreds of thousands of people would be worried whether they had been exposed, whether they were contaminated, whether they had to worry about it. And that's what community reception centers would be all about. Now, these two guys are the experts on that.
Well, and I imagine, when you think back at the old movies about radiation and the terrible things that happen to people, I mean, they have this very scary perception of what radiation actually does. And Armin, you could probably answer to that as far as exposure and what the CDC role would be in this.
Sure, of course. As you said, there's a lot of misconception, and just the word radiation creates so much fear in people. And one of the messages that we try to get across in an emergency when there's potential for contamination and exposure is that there are things that we can do to help protect ourselves. So and those things that we try to educate both professionals at local and state, and also public education for radiation emergencies. When we have a radiation emergency, and we have a release of radioactive materials into the environment. As Sherwin said, there's potential for exposure and people being contaminated with radioactive material. And there's even a larger number who think they're exposed or contaminated. Of course, they're concerned and they need to be screened and monitored. So some of that monitoring will be done in the field as first responders, and you have a first responder background. So some of that would happen right then as they're trying to help people evacuate an area if they need to, or and so forth. But reception centers, community reception centers come into play a day or two after the incident. They are at places that are pre-designated locations, fixed facilities that are used to then bring people in to screen them for radioactive contamination, assist them with decontamination, clean and washing them, and then prioritize them. Some of them need immediate help, attention. Some of them they don't, but you get that information for later follow-up if you need to. So that's the public health function, and I should say it's not just public health; it's a community function. Emergency management, law enforcement, public health, just like the pods. I think your audience are very familiar with pods, and the community reception center are very much like pods, and that's why we partnered with Sherwin in his community, because they do pod exercises all the time, and they were able to adopt principles for radiation screening and have the community reception centers built and exercised on that model.
That makes sense. So Kevin, would I assume your role has a lot to do with education in the community?
That's correct. A major push from CDC and ORAU has been reaching out to state and local partners and really trying to demystify radiation and empower those jurisdictions to respond confidently and competently to a radiation emergency. So population monitoring is one part in the entire response paradigm, but it's a really, really important part, because if people don't feel secure or safe during the response, it erodes that trust in the overall management of the response, and especially for radiation emergency, a hazard that is so misunderstood or poorly understood, it's really important to show that you have a confident workforce that can come and address those needs, even if they're perceived needs. I might be contaminated as opposed to real needs. I definitely know I'm contaminated. It's kind of easy to know when you're sick if you're talking about biological agents or you're talking about chemical exposure. But radiation, you don't see the effects right away, and there's so much mystery around it for so many people that we need to make sure we're really trying to address all of their concerns, not just the immediate concerns, but the long-term concerns. That's why we have registration initiatives afterwards. That's why we do a lot of extensive public health follow-up and really mental health counseling and providing services to address those mental and behavioral health needs as well. Very critical.
Once these people are registered in a center, you're able to track them? Because like you said, sometimes these things may not show up right away. Radiation has some very long-term effects. And working for a public safety agency, for a fire department, we of course worry about our responders and that we might walk into a situation in which we're not even aware that radiation is an element. And so that's a different perspective that, what do we do? What do we need to know walking into a radiation emergency? Now, a lot of departments carry Geiger counters, they carry CO2 detectors and that kind of thing, but beyond that, we don't get a great amount of education in radiation. Where can we learn more?
There's a lot of resources available. Some of them involves travel, and I know how difficult that is for some. So now the trend is to provide online training. And a number of organizations provide online training. Much of it is free, the ones that are produced by government. And we are now at CDC developing online modular training. There's a brief trainings, and of course they're free of charge. And we have the very first set. Actually, Kevin was involved in that, radiation basics, and that's a 1.5 hour of training done in the various segments, and Kevin was very instrumental in organizing that. So that's available. There's lots of training available that people can take. And you mentioned the first responder again. Another issue with population monitoring is that it impacts other public health and mass care functions. One thing about radiation emergencies is that you would have a displaced population, right? Mm-hmm. People might evacuate immediately, or they might shelter in place and then evacuate. But the end result is that potentially a large population that needs shelter. And if you don't do population monitoring, screening at community reception centers, then you can't support mass care also. So having the capability in the community level to be able to do that monitoring and screening, provide those services to people, would impact other functions too, including mass care.
I think we would all agree the more people know about a given subject, the less afraid of it they're going to be, and that there are resources, there are places to go, and there are people like you that are going to be there to let them know exactly what level of contamination they have, or the fact they don't have any at all, which would make them feel much better.
If I may add one more thing, is that
Certainly.
the importance of partnership with Sherwin at the MRC unit in actually my own community was extremely important, because none of the guidance documents and training stuff that we produce really means anything unless it can be adopted and implemented at the local level where the services are provided and work is performed. And Sherwin, through his leadership, I'll let him speak what he did instead of me talking. What he did in the community in our county was extremely important to demonstrate the concept that this can be done at the level, community level.
Well, our volunteers are very engaged and very interested in improving the safety of our community. I mean, that's why they volunteer. And of course, the issue of radiation is a little scary at first, but thanks to both of these gentlemen, they actually had very good training to familiarize themselves with what the hazards are. And it's like people who work with electricity or, use a stove. I mean, working with fire, it's just learning how. My 3-year-old granddaughter knows to stay away from the stove, but she doesn't really understand how to use it safely. She'll learn, and most people learn that, but really it isn't that much more complicated. You may not be able to see it, but there are ways to find out where it is, and they've learned how to use the instrumentation, how to understand what's involved, and that it's not an all or nothing proposition. Right now we are sitting here being exposed to radiation, and different kinds, but what we're talking about is ionizing radiation, and we're being exposed to more of that here right now than we would be in Chicago, because we're at roughly 1,000 feet elevation, and Chicago has 1,000 feet more air shielding from cosmic radiation. We're also more exposed because we're on granite, and there are more radioactive materials in granite than in the sandy soil of Chicago. Nobody worries about it a whole lot. That's part of just living. So it's a matter of degree. If I'm this far from the stove, I'm not getting burned. If I'm closer, my hand's warm. If that was too hot. It's really a matter of degree, and you have to learn that it's possible to be safe and not be worried about it.
Wow, this is an amazing subject, and I could certainly talk for another hour, but I think we're going to get booted off here very soon. Any parting thoughts that I'd love to maybe get the link on the CDC training that you have coming up so we can put that in the show notes.
Absolutely.
Because I think people would like to. I mean, I know a little of what you were talking about in terms of we learn in the field and in terms of shielding and time and distance and those kinds of things that maybe even the general public doesn't know. So any resource we have for folks to learn more about this is really helpful. Thank you so much. I mean, the collaborative effort between all of you, and even though what you do is very different, the fact you're coming together to educate the public, I think, is a wonderful thing.
Well, that's the first hurdle for rad preparedness. You have to have that baseline knowledge of the hazard. I mean, any hazard. If you don't have that baseline knowledge, you can't respond effectively. So hopefully we're making a dent in it.
Well, I'm going to walk away from the show feeling much better about what's out there and that you people are taking care of business, so I appreciate that.
Well, thank
so
you.
again, coming to you from Atlanta, Georgia, here at the Disaster Preparedness Summit, we thank NACCHO for letting us be a part of this and everything I'm learning. So from the Disaster Podcast, we'll say goodbye. I'm your host, Sam Bradley. My general line at the end of my podcast is that disaster medicine is not everyday medicine, but I'm going to add a little bit to that I believe disaster preparedness is everyone's business.